Good morning and welcome to the Caregiver Teleconnection. My name is Glenda Rogers and I'm going to be the facilitator for today's session with Dr. Elliot Sklar and Lucy Barylak. And today we're going to be talking about stress management. This is the final in our series about our health and our wealth, a health promotion program for caregivers. And so I'm glad that you're with us today. Before we get started with the presentation, let me introduce Lucy and Elliot to you. Got to put my glasses on here. So Dr. Elliot Sklar is a public health professional focused upon supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and for caregivers in Canada, Florida, and virtually. Dr. Sklar is an associate professor of healthcare science at Nova Southeastern University in Florida. He publishes and presents his work internationally, which is focused on the complexity of issues related to aging and caregiving. And now let me tell you about Lucy. Lucy Barylak received her master's degree in social work from McGill University and has dedicated her career to supporting caregivers. Lucy was the founder and long-term care manager of the Caregiver Support Center at a respite program for family caregivers. There, she oversaw multidisciplinary training across caregiving, mental health, elder abuse, and palliative care. In 2003 and in 2012, she received the Queen's Jubilee Award, presented by the Canadian Home Care Association, awarded for her dedication in developing a national coalition to support the issues and challenges facing informal caregivers. Lucy also co-edited a book for healthcare professionals entitled Responding Creatively to the Needs of Caregivers. She has been a key architect of screening and assessment tools of family caregivers, for which she provides training to healthcare professionals across North America. Lucy consults for private industry, including WellMed Charitable Foundation and clinics in Texas. Additionally, Lucy is a liaison supervisor for the School of Social Work at McGill University, where she currently supervises 20 interns. She would also like you to know that she cared for her mother for about 10 years. Welcome, Lucy and Elliot.
Thank you.
Thank you. Thanks so much. Welcome, everyone. Our series this month has been called Our Health is Our Wealth, as Glenda said, and it's a series really that focuses on promoting the health and well-being of caregivers and also care recipients, which is really at the heart of what Lucy and I do. We've talked in this series about nutrition and about fitness, the cornerstones of our physical health, and we've also talked about mental health. Today, we're talking about stress management, which certainly contributes to our mental health. As an example, if you can't manage your stress well, you might feel more anxious or you might have more trouble sleeping. So, why are we ending our series by discussing stress management? Well, because in the context of health, stress has many implications. Stress can result in health problems, and health problems can be also stressful to cope with. So I think stress management is something that all people and all caregivers especially need some refreshers on, even if we know how to handle our stress. But sometimes we, Lucy and I, certainly believe that prevention is the key. And that's why our series really, we wanted to end on this note about how to manage our stress, because it's so important in our everyday lives. So I want to remind everyone that stress spelled is actually dessert, spelled backwards. I happen to manage stress using humor as a way of coping with it. And I've also joked in some previous programs that we've done that ahead of buying hurricane supplies, when a hurricane is coming here in Florida where I live, there are never any chips or cookies left, but there's always tofu and rice cakes. So obviously, a lot of people use food to cope with their stress. Clearly, I use food and humor, but I also use physical activity. For me, that is my mechanism for coping with stress, definitely. When my husband and I bought our first house and we were in the process of relocating from an apartment that we had rented for 8 years, I remember at the time I was at the gym 7 days a week, sometimes twice a day, and including the morning of our move. And the annoying part in all of that was that I didn't lose a pound because I was eating all those desserts, but that's a whole other story. So when we have talked about health promotion for caregivers, one of the things that people have really enjoyed sharing when we talked about nutrition is how much they enjoy certain foods. That's always a topic in which we get a lot of participants sharing different tips, different things that they like, certain things they've introduced that are a little bit more healthful. So underneath this lovely image here, I did include a link to some easy low calorie and low sugar dessert recipes. So many of you previously have talked about foods and beverages that have been helpful during our series, from flavored water to hydration supplements and sugar-free items. So I'm just curious from our participants if you have found a connection between caregiving stress and your weight or diet. You can feel free to unmute yourself or enter your thoughts in the chat box.
And to the person that has called in on their telephone, you can press *6 on your telephone and it will unmute it.
Well, think about it because we will circle back on this a little bit later in our talk this morning. But certainly some of us, I think, use food as a way of coping with stress.
100%, Elliot, always, especially chocolate. That's a big one for me. Yeah. Anyways, thank you for that. Some stress can be good for you, believe it or not, as it helps you cope and respond to a change or challenge. But long-term stress of any kind, including caregiver stress, can lead to serious health problems. And we've talked about this before, but it's really good to remind ourselves. Caregivers also report symptoms of stress more often than people who are not caregivers. So some of the ways stress affects caregivers include depression and anxiety. Women who are caregivers are more likely than men to develop symptoms of anxiety and depression. Anxiety and depression also raise your risk for other health problems such as heart disease and stroke. Now, it also affects your weak immune system. It weakens it. Stress caregivers may have weaker immune system than non-caregivers and spend more days sick with cold or flu. A weak immune system can also make vaccines such as flu shots less effective. Also, it may take longer to recover from surgery. So this is what I learned, which was really, quite interesting, especially about the cold flu. Now, there's also the whole idea of obesity. Stress causes weight gain in more women than men. Obesity raises your risk for other health problems, including heart disease, stroke, and diabetes. So higher risk for chronic disease, high levels of stress, especially when combined with depression, can raise your risk for health problems such as heart disease, cancer, diabetes, and even arthritis. Problems with short-term memory or paying attention. That's interesting. Caregivers of spouses with Alzheimer's disease are higher risk for problems with short-term memory and focusing.
And we're going to talk about that as well. But
Yes.
It is a very timely issue talking about cold and flu because we're right ahead of flu season. And now is the time when people should be getting their flu vaccine. So if you haven't yet received your flu vaccine, please make sure to do so and also plan for it. A lot of people have sometimes feel sick afterward. I always try to take a day off or get the flu vaccine on a day, for example, Friday ahead of the weekend, so that if I'm not feeling my best, I account for that. So that is very important. I do want to ask everyone if you can recall the actual day that we went into lockdown because of COVID in March of 2020. What happened to you that day? Where were you when you heard about the lockdown being announced? Anyone?
I was at work and
You
they
were at
called
work.
a meeting. They would not let us leave that day for lunch. And they bought lunch in to everybody. And they had sent an email where each department sent email and said, this is what you need to get together. And then we had a meeting. And for some strange reason, when we went into the conference room, we couldn't sit by each other like how we do. How you go in there and sit by your favorite coworker? They said, skip a chair. I was like, what's going on? So they said, do this, this, and this. But the bottom line was, we didn't get it. When they let us leave, they said, you know, like we were children, go to the grocery store, get groceries, and then go straight home. That's what they told us.
Absolutely. Thank you for sharing that, Dorothy.
Yeah.
I can imagine that was likely a scary day.
It was, because I had no idea what's going on.
Absolutely. And we had someone else in the chat, and Ashley said that she was at work. So it's interesting. We have 14 participants today, and I'm sure some of you also remember what happened to you that day. But if you don't remember all of the exact details of that day or that week, it's because stress and memory are actually linked. And stress affects how memories are formed. So when we're stressed, we have a more difficult time creating short-term memories and turning those short-term memories into long-term memories, meaning that it's difficult for us to learn when we're stressed. Stress can also affect the type of memories that we form. So if we're stressed during an event, we might have more difficulty remembering something accurately later, as the stress that we felt can actually change our perception and our ability to recall what we perceived at the time. So if you think about it, that's actually why eyewitness testimony is so unreliable, because we can have multiple people who were there at the same time. All of them are sure that they saw something in a certain way, but that doesn't mean that they're all correct. And usually there'll be a variance in how people recall things. So, you know me, I love to look at research, and there was a recent meta-analysis, which is a very powerful type of study. It's a type of study that looks at all of the study's findings that came before it on a certain topic. And this study included 113 studies on stress that came before it. And the researchers were examining many independent studies on stress and memory to determine what the major findings were across these 113 studies. So it makes for much more powerful results. And there was a lot of evidence across these 113 studies that showed that stress affects memory, and these studies gave more support to all of that research. Stress can also lead to exhaustion, and exhaustion can actually lead to cognitive impairment. That includes issues with our attention and our working memory. Think about driving when you're very, very tired. We know it's not something that you're supposed to do, because driving, of course, requires our attention. So unfortunately, memory impairment can still be detected years later, even after that exhaustion has been addressed. So in the case of caregivers, when you're going through a very, very stressful time, the circumstances around that period of time and the memories you form during that time will not be as sharp as during another period of time, for example, when you weren't going through a crisis. And that really underscores the importance of managing stress as best as we can. So I wanted to ask if anyone can relate to this. I know for me personally, when I thought about this, I was able to recognize that during periods of my life when I've had more stressors, I've had a harder time concentrating and remembering things. So I wanted to ask what your experiences are. And if you can't remember, it just means you're stressed.
I can actually say I really agree with you. I think on a personal level, and what some caregivers tell me is that, especially when they go to the doctor, okay, it's a stressful situation. Let's say you're going to the doctor knowing that you had some sort of a test and you're going to get the results. And many times people just they have in mind all the questions that they want to ask the doctor, but for whatever reason, they're so stressed out that they actually don't ask all the questions. They leave the office and say, well, why didn't I ask that? Or I should have asked this thing. So it really is, it could be as minor, it's not minor, but as minor as that. And we have to recognize that. And maybe in the next, if you have to repeat that, to really put everything down. So I can relate to that for sure.
Absolutely. Ashley said, I notice when I'm more stressed, I struggle more with trying to remember. And sometimes I notice it while I'm at work. I think that that's right on the money. I'm a professor. So I work with students who are often experiencing stress, either because they're also working and also parents, or because they have multiple exams or midterms at the same time. And the stress management aspect of things is so critical for students because otherwise it can certainly impact their academic performance. So when students are in college, we try to teach them about how to manage stress. But these are life skills that we all need reminders of all the time, because stress comes up all the time when we least expect it, and certainly when people are providing care.
For sure.
Anyone
Okay.
else?
Oh.
Just wanted to see if anyone had any last thoughts before we
Okay.
moved on. All right, you'll remember later, maybe.
So having said that about memory, there is things that you can do. So let's look at how we can, improve your memory under stress. So there are several things you can do to improve your memory. Fortunately, these techniques also help manage stress. So that's a two-way. So really, let's really look at that. One of the most important things to do is to practice personal self-care. We keep saying it over and over, but it actually works. Get enough sleep, eat a healthy diet, and manage stress. Now, poor sleep, high stress, and other physical problems can affect memory, as we said, as well as contributing to the stress that hinder memory functioning and how we remember in general. There are other important strategies you can use as well. So let's look at that. So here are some research-backed strategies that are really powerful. Train yourself in breathing exercises and other techniques. One study of police cadets in training has found that psychological performance training can improve the recall of cadets who experience stress compared to those who didn't learn and practice this technique. So the technique that were used including breathing exercise, a popular stress management technique, mental performance imagery, now that's a good one, which involves vividly imagining practice and success. So you actually imagine it and attentional focus. This means that when stressed, you can focus on breathing and focusing your attention, as well as vividly imagining yourself reaching your goal. This has proven benefits. All right. And I think a lot of people it's something that people are starting to do, to imagine what you want to achieve in your life. The other thing is get moving. That's exactly what Elliot does all the time when he's stressed, right, Elliot? A study that examined the effects of aerobic exercise program on memory impaired people found that a 12-week exercise program indeed improved their memory over those who didn't enroll in the program. The subject involved in the study were experiencing a mild cognitive impairment from the effects of stress-related exhaustion. So these results are especially relevant for those who are stressed. The other thing that we want to talk about is practice mindfulness. Research found that practicing mindfulness can help with your memory, not only by minimizing the stress that can be impairing it, but also by enabling better quality of sleep. One study which showed that those who experience stress and memory issues often experience sleep problems. So maybe you can relate to that. If you're stressed, you don't get good night's sleep, you wake up tired, it's just a vicious circle. Found that practicing mindfulness results is less stress as well as fewer memory issues and sleep problems. Additionally, since mindfulness is based around being more aware of the present, stay in the present, you may be better able to pay attention and to remember details you might not have otherwise. So what it really means, stay in the present, don't think of what the future is going to be, and don't go back to the past. It's easier said than done, but it's certainly a very good technique. And I have to tell you, that's the way I live my life.
It requires a lot of practice.
It does.
So we did get a comment from Teresa, who said that she has been a caregiver for over 12 years. And Teresa said, I'm finding it increasingly, I'm increasingly struggling with remembering everyday tasks without making written schedules and notes. And I thank Teresa for sharing in our chat. And this is very common among caregivers who have been providing care for a long period of time. But what I was curious to know from Teresa is if she had mentioned this to her doctor as well, because, Teresa just said yes, but she does not seem concerned. That's great. The reason I ask is because 12 years is a long time, and the age you were when you began your caregiving journey is not the age you are now. So certain things can also compound with that. But Lucy and I have shared research, but also our own experiences, certainly, that when we're feeling stressed, that can affect our memory, our ability to focus, our attention. So imagine feeling stressed on a prolonged basis for 12 years. It would be normal or common, I should say, not normal, but common to experience some changes with your memory. And Lucy, I don't know if you have something else you might want to add.
Well, I think that all the tips that we're kind of talking about is something that maybe you could start, practicing a little bit more. But the other thing that I want to say that it's so important not to immerse yourself totally in the caregiving journey. But I hope that you don't isolate yourself. I hope that you are able to go and meet with friends and family, do something totally different apart from caregiving. Give yourself respite because your brain really needs that. And you might feel refreshed and energized. So I hope those are some of the things that I would recommend.
I'll drink to that. Although, of course, we're not recommending drinking to relieve your stress.
I'm glad you said that, Elliot.
Of course. I meant coffee. Decaf.
Yes, coffee is good. I just found out that coffee is actually good for certain things.
Yes, and the reason why we share a lot of this too is because sometimes our care recipients are experiencing stress. It is stressful to be a patient. It is stressful to have cognitive deficits, and certainly at the beginning of that journey to be aware of that. So many of these techniques are also very helpful that you can do with a care recipient if they're well enough. Just as an example, being in nature and being outside has a tremendously positive impact upon our stress. And that is one of the reasons why more and more workplaces ahead of the pandemic were trying to incorporate outdoor spaces for their employees to go out and have lunch outside during the day, not because of benevolence, but because they were more productive then for the remaining part of the day. So there's a lot of research that backs all of this up, but it's important for caregivers and for care recipients. And I think a main takeaway from our time today is that the time that you take away from caregiving, just as Lucy said, is as important as the time you spend providing care, because we all need to recharge. And I think that's really, really important. So one of the things that is very important is a very practical piece of advice, but it seems to escape many of us very often. And that is not to layer stress on top of stress. So what do I mean here? If you're going through a stressful time as a caregiver, try not to take on more stressors unless you absolutely have to. So, as an example, if you're a caregiver, maybe this isn't the best time for a home remodel or for a career change. Getting through can be good enough for the time being, which is something many of us don't recognize. You know, caregivers in some research are given what's known as the Zarit Caregiver Burden Scale. And it's an assessment to see where their level of caregiver burden is. And what we hope to see with caregivers over time is not an improvement actually in their level of burden, but rather that their burden doesn't increase. Because over time, the demands of caregiving are usually going to increase. So that's why in this type of a score, we hope to just see that people stay even, because what that means is they're actually coping better as their situation of caregiving is becoming more demanding. So in parallel, as I said before, I'm a teacher. I have doctoral students who are adults, who are caregivers, who are parents. And I often advise them to pace their academic goals because of the nature of being a full-time employee, a parent, potentially a caregiver. There's no need to layer stress on top of stress or to have overly ambitious goals or timelines in addition to other stressors. Now, for some caregivers, that might mean not cooking a whole holiday meal and instead hosting a potluck as the holidays are coming up. For others, it might mean preparing for hurricane season so that you're not without a plan. And that plan, by the way, can be to depend on someone else to do your planning and to also, take you and your care recipient with if you need to evacuate. So there are lots of ways that we can avoid layering stress on top of stress by preparing for things, by asking for help when we need it. But ultimately, it means not being caught off guard. That can mean, for example, knowing that a lantern is better than a flashlight in the event of a power outage for someone with dementia. And that could include planning and preparing for placement if and when that time might come, so that it's not completely overwhelming. I think that knowledge is power, and I like knowing what options exist ahead of needing to make decisions so that we're never in an emergency situation. Just like it's good to know the closest hospital to where you live, it can also be good to know the best long-term care options based upon your location, finances, availability, preference, just as an example. So I was curious again if anyone has any input on things that they might have deferred or put off, or if they have any examples of how they may have, not layered stress on top of stress.
Yes, please go ahead.
Good morning. I wanted to say to you, it's very interesting that you should mention about don't do any renovations on your house. But anyway, I was a caregiver full time for 3.5 years. It is very stressful. So I still help out with other relatives. But what happened was I put a note on my refrigerator because you want to help people. Say no and be quiet. So I'm not taking on anything else. But, when somebody says something, you say, oh, I can help you so and so and so. No, be quiet and say no if somebody asks me, because I don't need to take on any more stresses because I'm working on myself. So, therefore, I had had some work done on my house, kind of emergency, because, it's getting ready to get winter and having some leaks and stuff. Take care of that. So the contractor say, hey, come in so and so in time, so and so in time. Well, I'm working on myself, and I go to the gym, get in swimming exercises a couple days a week. So they come in, I stay home. I said, no more. If they not coming, they coming on my days I go swimming. You can't come until 10 o'clock. I go for 8 o'clock in the morning to 10. So you have to come after that. I'm not sacrificing my time when I don't know whether you're gonna be able to make the time. So I'm in that situation. But it's funny that you say, I'm like, I ain't doing no more projects when I finish this one till next year. But it's funny that you should mention that. But I'm trying to say, no, I just have a tendency, you want to help people, you want to tell them stuff, you do. I got to say no, so I have to have notes. I need to put it a couple other places, but on the refrigerator, I see it every morning when I come down, get ready to open up the refrigerator. No, you're not doing nothing else. No. So that's my suggestion to help to keep your stress down. And I don't rush anymore with anything. Okay, if I'm going to be late, okay, I'm going to be late. But I'm finding that I'm starting to can't remember where I put my shoes. I can't remember where I put my keys. So I have places for them now, but still every once in a while I misplace it. But I don't rush. Take my time. It's going to be a few minutes later. And I try to prepare so I have extra time so that when I'm running late, or I get there early and then I can sit and deep breathe, like you said, before I go into my class or to the meeting or to the doctors. But the biggest thing is for me is the word no.
Well, yeah,
Oh,
we got the message loud and clear. I think what you're really talking about, which I always say, it's a balancing act. There's two people involved in this relationship, okay? And each one is as important as the other one. So good for you for saying no. That's a good strategy. So let's move on to strategies dealing with caregiver stress. Okay, now we know that the emotional and physical demands involving in caregiving put strain. That's why it's so important to take advantage of the many resources and tools available to help you provide care for your loved one. Remember, if you don't take care of yourself, as the last person told us, you won't be able to care for anyone else. All right. So the other thing is to also keep in mind is that you're not the only one that can provide the care for your loved one. So let's look at how to help manage caregiver stress. And again, as I said, accept help. Be prepared with a list of ways that others can help you and let the helper choose what he or she would like to do. For instance, a friend may offer to take the person you care for a walk a couple of times a week, or a friend or family member may be able to run an errand, pick up your groceries, or cook for you. Accept it. It's okay. And it's important that you do. Focus on what you are able to provide. It's normal to feel guilty sometimes, but understand that no one, in quotation, is a perfect caregiver. It doesn't exist, and I had to find that out for myself as well. Believe that you're doing the best you can and making the best decision you can at any given time. Set realistic goals. That's what Elliot was also speaking about. Break large tasks into smaller steps that you can do one at a time. Prioritize, make a list, and establish a daily routine. That is extremely helpful to have that. Begin to say no. You see, you're right on to requests that are draining, such as hosting holiday meals or anything else. Get connected. Find out about caregiving resources in your community. Many communities have classes specifically about the disease your loved one is facing. Education is powerful. It lets you know what to expect and how to handle it. Caregiving services such as transportation, meal delivery, or housekeeping may be available to help you. Seek social support. Okay, we're talking about that. Make an effort to stay well connected with family and friends who can offer non-judgmental emotional support. They just accept you for who you are. Set aside time each week by connecting, even if it's just to go for a walk with a friend. Set personal health goals. For example, set goals to establish good sleeping routine, find time to be physically active. On most days of the week, eat a healthy diet and drink plenty of water. As Elliot told us many times, 15 minutes a day, even if you go for a walk, really helps. So try it out. You don't have to join a gym. Many caregivers have issues with sleeping. So quality of sleep over a long period of poor quality can cause health issues. And we know that if we don't sleep well, we're drowsy the next day, we can't concentrate. If you have trouble getting a good night's sleep, I do think that you could talk to your doctor if it's a pattern that you cannot break. See your doctor, get a recommended vaccination and screening. Make sure to tell your doctor that you're a caregiver. Don't hesitate to mention any concerns or symptoms that you may have. So what it boils down to, the balancing act, it's time you need to take care of yourself so that you can manage the stress and anxiety and not get to a point when you're so depressed that you can't even function.
Absolutely. And to our caller's point previously, I think that doing preventive home repairs, ahead of winter months is a very good thing. I was talking about, maybe don't repaint or choose to wallpaper, things that are cosmetic, but certainly taking care of things around the house so that you don't have further problems is a great way to avoid future stress and expenses. And I love all of these tips here because not everything's going to work for everybody. Some of us don't, manage a routine as well as others, for example. And for some people, routine is super important. I think the key here is there's no perfection, that we need to be kind to ourselves and recognize that we do the best that we can. Now, Lucy talked a little bit earlier about healthcare stress, and that's a really big one. Many caregivers are anxious or avoidant about seeing the doctor. And if you are and you're participating today, you're not alone. For most people, going to the doctor can be stressful. And we know from research as well that many caregivers put off doctor appointments, but especially women. And the data actually doesn't tell us why that is. But many people think it's because of a lack of available time or respite, but it could actually be related to stress. Because if you find that going to the doctor is stressful, then you might already be practicing one of the tips I just shared by not layering stressors. So I think that there are some caregivers who feel overwhelmed at the prospect of the stress of daily caregiving, and that to care for their own health can feel almost so unmanageable or overwhelming. Now, this can also be amplified if you're a caregiver for someone who's always sick. You're much more aware of the impact that sickness can have in disrupting our quality of life and our existence. And that's exactly where prevention is so important, and seeing a doctor sooner than later can be critical. If you've not had a physical or a routine preventive health screening, like a mammogram, we still are in October, Breast Cancer Awareness Month, please do so. If you need a colonoscopy, please do so. Now, I want to speak to that last point about colonoscopies and add that there are new tests like Cologuard, for example, that you could do at home. It's an in-home test for colon cancer that is actually covered by insurance. And in some cases, if you do not have a high risk, then it could be substituted for a colonoscopy, particularly if you're a caregiver and you don't have the downtime for a colonoscopy right now. So I'm just using that as one example of new screening tools that we have out there that are less invasive and require less downtime for us to need as caregivers to make arrangements for respite care or for someone to care for your loved one. So these are just some strategies and ideas here, but That's really where the prevention piece comes in, because when you have coping tools, it makes stress much more manageable. You can also do things like when you go to the doctor, writing down all of your concerns and questions so that you don't forget. And try to avoid things ahead of doctor appointments that can heighten anxiety, like caffeine, as an example, if you're someone who gets stressed. So these are some ideas, but many of us learn our coping skills in our upbringing. We model things that we saw our parents doing. And I'm just curious if anyone thinking about that, do you recognize things that you do that help you cope with stress that maybe one of your parents did? Or do you do something completely different? Would love to hear from our participants. And it can relate to healthcare stress or not.
Elliot, it's interesting because I don't think many people think that question, like you have to really think about it. How do I manage my stress? So please, everyone, just kind of think about it for a minute. I see that somebody did respond, a couple.
Yeah.
That would be great. Love to hear it.
Ashley said crafts. I grew up with my mom doing cross stitch and I picked it up. That's a great coping mechanism.
Amazing.
And something that you can potentially also take with you, for example, to a medical appointment if you need to while waiting. It's a great thing that can help you manage your stress. When I'm stressed and I'm at a doctor's appointment, I look at photos of my dog. That helps to calm me down.
Well,
But
I was just thinking, because you kind of took me off guard also when asking that question. I think if I'm honest with myself, I think baking and cooking, like even if I don't have to, it's not for a meal that day, but maybe I'll make a big pot of vegetable soup and freeze it, or bake something, put it in the freezer. I didn't think about it before, but that's one of the stressors. And as everybody knows that you've seen or heard me before, I'll put on music and I will dance around my living room as I see a smile from Darcy. Yes.
And Sonia said I like to enjoy nature, so I do gardening, which is an amazing, amazing thing. Gardening and
Yes,
being in nature are very helpful with stress for sure.
it is.
I noticed when I was growing up that my mom would bake more when she was anxious or stressed, to the point where, I don't know, somewhere in my late teens or early 20s, I remember coming downstairs in the morning and my mom was already baking something, and I put my arm around her and said, "What are you anxious about?" Because I knew her pattern, her routine. And I think that I do also bake when I feel anxious. There's something calming about it. And the smell of baked goods at home is a very comforting thing.
It's almost like a ritual, there's a process, there's a ritual to it. Some people are very, some people pray, some people
Yeah.
feel connected in a more spiritual way.
Dorothy said, I color. I love Snoopy and
Oh,
I order coloring books from Amazon and I collect crayons. I have so many different kinds. I love that. And those are really, really, really helpful. They do help to calm us down when we're feeling stressed. I used to always have one in my desk when I worked in an office and was in so many meetings. I think I feel less stressed working from my home, which has been stressful for many people right now, having to return to office. So I really appreciate so many of you sharing your own experiences, because we don't recognize that a lot of what we call coping skills are things that we model, that we grew up with. Sometimes they're healthy ones and sometimes not so healthy. So that's why it's good to sort of take stock of that. And of course, last but not least here, as we talk about stress management, you need respite as a caregiver. I've said this before, but if you have one takeaway from today, please remember that the time you spend away from your caregiving responsibilities is as important as your role as a caregiver. Many people don't recognize that, and instead feel guilt for needing to take a break or feeling like they need a break. But it is as important, and everyone needs a break. It might be hard to imagine leaving your loved one in someone else's care, but taking a break can be one of the best things you do for yourself, as well as for the person you're caring for. I recommend that caregivers take bathroom breaks a couple of times during the day when they don't need to go to the bathroom, just so you have a couple of minutes to breathe. And that can actually be to practice some of the breathing techniques that Lucy shared. There is also in-home respite if you need it. We are going to share some resources on our next slide. But home health aides can come to your home to provide companionship, nursing care services, or both. Dorsey just said that is a part of my job here as Area Agency on Aging, and she offers respite. And that is one of the resources we will be sharing, is how to find your local Area Agency on Aging. There are also adult day centers and programs, and some actually provide care for younger and older people, so for children and older adults. And sometimes the groups spend time together, which can be really nice. There are also short-term nursing homes, assisted living homes, memory care homes. There are tons of options. I really, really do recommend checking with your local AAA to see what might be available in your local community. We always suggest calling 211 from any phone so that you can ask for referrals for respite, for example, but also your number to your local AAA. And in some states, Medicaid covers respite care for caregivers, and Medicare covers respite care if a person is receiving hospice care. But individual private insurance plans vary. So I really recommend inquiring. And if you, again, thinking of prevention, if you can start saving for out-of-pocket costs that might relate to respite care that you might need down the line, then you'll have those funds saved away. So Lucy, I'm not sure if you have any concluding remarks or thoughts you wanted to share as well.
Well, I think all of this, respite is so important, but, some caregivers feel guilty or are scared to leave their loved one with a stranger or a day center. And I think that's normal. I mean, I can relate to that for sure. But I think because it's so important, you should look at what would make you comfortable leaving somebody with, let's say, a private person at home. Well, you need to do references, those are important to see who are you hiring. I think the other thing is to really make sure that the person that you're leaving your loved one with knows what their likes and dislikes are. You can write things down, you can look at the schedule, and you can start by very short periods of time. You don't have to go for the whole afternoon. Maybe try it out for an hour. Leave your cell phone. Reassure the person that if anything at all happens, you're just within reach, that they can call you. If you feel that you need to connect a few more times, go ahead, make those calls. The same thing is with day centers are amazing. I used to run many of them, and they're so beneficial because once the person came in, they were happy to be there. Okay, so the same thing. Research what's available. Talk to the people that are running these day centers, these respite program. Ask them questions that for example, maybe you have a fear. Would they take your loved one to the bathroom? Are there snacks? What if there's a fire? What are the procedures for evacuation? Can I call when I'm away? All the questions that you might fear. And here is my phone number. Call me as soon as possible. I'll come right back. I don't want them to cry. I don't want them to be afraid. So then you're kind of taking control. But it is so very important to have that time out. That's a big one for coping with stress, anxiety, and depression.
And using technology to our advantage. If you do leave someone at home, get a webcam, a baby monitor, something like that you can find easily on Amazon. You can then monitor what's going on when you're not there. I do that with my puppy, and it makes me feel much less stressed. So I think that, there are many ways that we can go about things that help us feel more secure. We have some resources to share, as we always do. We started off with an image of lavender fields because lavender is very good for managing stress, and it's used in aromatherapy. And then ending with this railroad because caregiving is a journey. As we all know, we have resources to share for mental health. You can call 988. I'm just sharing this because I know we have someone on the phone. And again, I mentioned calling 211 as a local information and referral resource line. We have some other resources here, and we'll be sharing a copy of our slides. And I wanted to leave you all with a Japanese proverb that I learned of yesterday that I thought was sort of appropriate as an ending note for this series, especially as we talk about mental health and managing our stress. If you feel like you're losing everything, remember, trees lose their leaves every year, and yet they stand tall and wait for better days to come. And since it's autumn, I thought that was appropriate. And now I'll turn it over to you, Glenda.
Oh, thank you so much. I love that picture. It just came into my mind. It's beautiful. We have a couple of more sessions left in the month of October, which I can't believe, but it's over. On Thursday, that would be tomorrow on the 26th at 1 o'clock, Dr. Jamie Heisman's going to be back with you. He's going to be talking about taking off your mask. And he's talking about the mask as hiding your true self. So if you've been tuning in with him every month, I encourage you to tune into that session. And then on Halloween, Tuesday, October the 31st at 10 o'clock Central Time, this goes right along with what we've been talking about, is healthy eating in the holidays with June Jacobs. And she talks about nutrition and how to do food exchanges and cook healthy during the holidays. So I encourage you also to tune in for that. The November calendar will be out soon. If you've registered for these calls, I think that you get that calendar in an email. If not, you can call our customer service representative because we have somebody on the phone that is toll free at 866-390-6491. I failed to ask y'all at the beginning, are you staying on after for this session?
Yeah, I was just going to mention that for those who would like to stay on and have an anonymous, unrecorded, unscripted conversation with us, we will be staying on for an additional 30 minutes.
I love how Minerva pops these things up that I forget to mention. Thank you, Minerva. The Caregiver Summit is coming up in November. November the 9th is the English Caregiver Summit. And I would encourage you to go to the link that's there on the chat box and look over that. I understand from what I've been told, you can go in person at various locations, smaller groups. You can also go in virtually and attend the Caregiver Summit this year. So that's really wonderful for everybody all over the country. But that link right there will take you to the summit information and registration, and you can look there and find out what's all going on. Also, there's going to be a Spanish language version that's going to happen on the 16th of November. So that's available to you also. All righty. I want to thank you all for being with us today, and I'm going to log off for now, and you can stay on with Lucy and Elliot, and I will see you all soon, I hope. Take care, and thank you so much for what you do.
Thank you, Glenda.
Bye-bye.
Thank you.